Good morning. Thank you very much for the invitation. It's really an honor for me to be here, and I'm very happy that we can have this meeting here in Latin America. So, because we are always a little bit forgotten in the world. I will give my talk in Spanish as we are global. I was told to give it in Spanish, so I hope everyone has translation okay. So my slides are in English anyway, so you will... Okay, how does this work here? Okay. Okay, so I'm a urologist in Chile, in Santiago. We are, as Chile, we're far away from everywhere. So even for me, it's also a long journey to come here. It's a long trip. But I work at that hospital. This is a private hospital in Santiago. It's the biggest private hospital in Santiago with about 400 beds. And I will give you a talk about the impact in Latin America, and obviously with more facts and data from Chile, which I come from. So
Latin America is a not very well developed area of the world. It's a third world country. The Human Development Index, which is the index in charge of the United Nations to determine the human social development. The darker the color, let me use the pointer. The darker, the more developed. North America, Australia, Japan, etc. are more developed. And the lighter color is less developed. Latin America, from Mexico up all the way to Chile, we are like in the middle. These are the places that I would like to point out. If we go to the health index, another determination made by the United Nations to see health care in general, we are more or less in the middle, but we can say we are slightly better. This is the agenda. Hard data, problems of bladder cancer in Latin America. I will discuss the patient's journey. I'll speak about two specific scenarios that are important to improve things and to round up all the opportunities. We all know that bladder cancer is the 6th more frequent cancer in the world and the 7th one in females. But in developed countries, Europe, United States, Australia, it's more frequent, and in women we have that it is the 13th, saying that this is a disease that takes place in less developed countries. This is evident, and we will later speak about the lack of speaking about bladder cancer in Latin America. There is an evident trend in both males and females, an increase in the incidence as the Human Development Index is increased. It is more frequent where the development is higher. Where we go to the incidence by regions, men and women, these are all developed countries, Europe, North America, and as this goes down, the incidence is also going down. There are two regions, Central America and South America, that are shown on the table that are in the lower part. This is a less frequent disease in Latin America. These are 23,000 cases. In terms of prevalence, more than 100,000 patients with bladder cancer in the last 10 years. I shouldn't say that this is a minor thing. It's an important burden. In Latin America, we are not homogeneous either. You can see that there's high incidence in the southern cone, in the austral part of the continent, Puerto Rico, Chile, Argentina. And there's also high heterogeneity in the continent. In my country, Chile, with 18 million inhabitants, we have 1,600 new cases every year. This might sound a minor thing, but it's an important reality for us. And I just said that the prevalence, meaning how many patients we have around with these diseases, more than 5,000 cases. So this is something very important for our reality. Why does this happen? What is the difference? Why is the difference between the developed and underdeveloped countries? This is a tumor of smokers, there's no doubt. But this is something very interesting. These are the stages of the epidemic of smoking. Stage 1, 2, 3, and 4, depending on the onset of the consumption and then mortality attributed to smoking. These countries down here in Latin America, we are in this stage. Developed countries are in the last stage where tobacco consumption began to drop. In Europe, in the United States, this has gone down very importantly. And in our continent, we are in the peak of consumption. So all the consequences as mortality, this is what is happening. It has to do with time, and in the future, we will have a similar incidence than developed countries. In underdeveloped country, we have earlier stages of this epidemic. And the people of the tobacco industry do realize this is happening. So the objective in terms of marketing in the third world is facing this situation. And also we have an aging population. I'll elaborate on that later. Speaking about smoking prevalence in Latin America, all countries here are affected. This is the incidence of the last 3 decades that has begun to go down. In Chile, this is a country where more people smoke. We used to be at a 40% level. Now we are at a 28 level, but it's still high. In green, we show the incidence of young adults. Obviously, this is a great issue because this means young people that smoke. Even though this has gone down, nonetheless, this tells us that in the next couple of decades, we will have a lot of bladder cancer and the other consequences of smoking. In Chile, this has gone down to 30%. We are at 36% level. And not by chance. There was a law enacted that importantly restricted the use of tobacco. In the past, you could smoke everywhere, and this is not the case anymore. But unfortunately, you know that there are consequences that go back to many decades. This is a disease of older people. If you see the concentration of males and women, it's around 6th, 7th decade of life. What is going on in Latin America? This is what happens every day in the Latin American countries in this y-axis. And practically most of them have life expectancy of more than 70 years. So this is another factor that is causing the phenomenon of the diseases in Latin America. And for sure we will have more bladder cases because every day we are facing this with other things, of course, but especially speaking about bladder cancer. What are the projections? This is a study that appeared last year in urology. They estimate the increase in bladder cancer in the various zones. In Latin America, after Africa, this is where it will grow more. We are down there, but we are going to face all these cases and to have results until 2040, which is a long time. This is very far away still. But this is a study that we conducted locally in our country to see the incidence in the hospital setting, everything that this disease requires. This is in Chile, of course. These are admission hospital rates in Chile. And here you see that there is a trend in both females and males. And about the incidence of primary cases, there's something important since 2006 on. This has gone up. We are now seeing a greater incidence. But this is something very important. I'm always impressed. These are surgeries due to bladder cancer. Endoscopic resection is one of them, or radical cystectomy. In this time period, 2004 to 2006, there were cystoscopies performed and these surgeries with the numbers shown on the slide. Meaning we now have a better health access, but this is mainly explained because there's an increase in incidence. Because, well, in 20 years, we can say that we have improved somewhat, but not very much. Bladder cancer is more and more demanding. This is worrisome. There's a high prevalence. We all know that there is low mortality, but this means that patients are kept alive when they are aging. But this entails more costs. This is the most expensive because we have high rates of recurrences. Patients survive a long time, so this requires surveillance. And these are, of course, relevant facts. What happens with the health expenditure, meaning the cost, the health costs? This is an interesting graph showing the percentage of the GDP in countries in terms of health. Developed countries are at the forefront. North America, Europe, Australia. Here we depict Latin America and some countries are closer than other countries, but in Latin America, only Argentina, Brazil, and Chile. And I believe I'm forgetting Costa Rica and Uruguay that spend more than $1 million in patients for health care. This is impressive. If you go to the European countries, it's more than $10,000 per person, per patient. In per capita terms, here the difference is very important. This is absolute expenditures and per capita expenditures. There's a huge difference between developed and underdeveloped countries. What happens with health systems in Latin America? This is a mixed health system. It's sometimes the case in some European countries. So public and private entities share the health care, but 25% has to receive care from the public sector. So this is a mixed kind of health system, and this is eroding the situation. People having the resources can pay for private care, and they don't go to the public health care. There's a disparity, and we published this last year about the impact in terms of bladder cancer. And this graph shows something that is very appealing. There's 3 lines here. The first one is hospital stay for bladder cancer between 2001 2009, and you see that the second line depicts public patients and the third one is private patients. You can see an impressive difference. This is something that shows the difference once more. You might say, well, private patients are healthier, but there are other things. The access system, public systems receive patients later. And in spite of having costs that are a problem, there's also great disparity in Latin America. However, the basic health care in bladder cancer is covered. not much access to high-cost drugs to tackle bladder cancer. There are programs, but they are isolated programs. There's no national policy. And the part of genetic assessment, for example, is very far from our reality still. Aside from some anecdotic experiences, the truth is that these aspects are not considered. But what is the most important element for us to show as relevant is our current situation. In terms of studies in Latin America, we do have a very serious problem here. We discussed this with my colleague from Argentina. We don't know how we are doing. We don't know what we are doing. We don't have any cancer registries that are accurate. So it is really difficult to establish effective public health policies if we don't have this information. The registries are lacking, and in general, information is lacking. Very briefly, this is how patients do in a public hospital in Santiago, a city with 7 million inhabitants. This is a hospital in the southeastern part. It looks new. It is new. And the problem is not so much the infrastructure, but what is going on there. This is an example. A patient with a bladder cancer in a public hospital. This is module 1. At the very entrance of the hospital, the patient, this is what he or she first sees. After the patient has been seen by primary or general practitioners. And then the patient is sent to the urologist. And then the patient has to register in the cancer module. So the patient has to go to another place. And after this, the patient has to schedule the hours. That's module 3 for the follow-up. And then they have to also schedule lab tests, cystoscopy, either control or diagnostic cystoscopy, module 4. And then they go back to module 1. And if they have to get an operation, they have to go back to module 5. You can see all this journey that is really burdensome for patients. So immediately this shows that management is very important. Beyond this, something else that is happening in Chile, there's more than 1 million people waiting for bladder cancer surgery, not elective surgery. This is the same thing in Argentina or in all Latin America. So considering this standpoint, we can have a beautiful infrastructure, but what's the case if we cannot provide the right health care? Now, public expense. Patients in Chile, they collect their own money. They do whatever is necessary, contests or lotteries, whatever, to go to the private system. And then there's the financial stress and toxicity, showing how we are doing in our country in this regard. He can do fine with his or her cancer, but there's also the financial aspect that is really hitting them. And then very specific scenarios here. There's an interesting study. Our populations in Latin America are vaccinated against TB, but we still have TB in Latin America. So we have some kind of immunity against this bacterium. This study was published in Spanish a couple of years ago, showing that in those patients where there's a BCG vaccine, the incidence of bladder cancer is lower, hand in hand with the social economic development. But indeed, there is a difference, and this might be good. Probably BCG plays a role to protect us against TB. And beyond this, there's a Japanese study where they assessed how patients respond to BCG depending on the system. In terms of recurrence, which is the upper line, recurrence is much lower than those that are vaccinated. And this is also an experience in our country. It was published last year. 26 patients treated with BCG, and we had a very strict, well-done BCG regimen. And the recurrence was 20%, much less than what is reported outside. And also high grade 12% and BCG not responder 7%. So we said probably our patients respond better to BCG. This might be an opportunity. Another scenario, this is an anecdote. In the northern part of Chile, here in the Antofagasta region, you know that Chile is a very long country with mountains. We have in the northern part of Chile the heart of the copper industry. This is a region exposed to arsenic in water. As you know, it is a natural geographic factor in deep waters. I'm showing the map. So this is a reality in some other parts of the world. 100 million people have been affected by this situation. We don't know much because this has not been studied enough, because in the first world countries, they don't have this problem. In Chile, there's important concentrations in the northern part. This was during the 50s. Waters from a contaminated river with arsenic was found, and this is a number of people, 400,000 people affected. All the carcinogenic effect is seen. These are arsenic concentration in 55 to 70s. This is something that was published by the World Health Organization. And these are the numbers of mortality cases in Antofagasta. In the 70s, this went skyrocketed. And this is the mortality that was reached. And in women, things were even worse. And this is the deaths in Antofagasta, a very important portion with bladder cancer. This was also mentioned in a publication. Tumors were more advanced in these regions, more aggressive, with the same predictive factors. As I'm saying, there are special scenarios like in Argentina, the city of Buenos Aires with this problem. This is something that is currently happening. The exposure is already over, but the problem persists. What are the opportunities to increase resources? Well, not only is a matter of giving money. This is something that has to do with management. In Chile, money has been obtained, but not enough appropriate management. Public and private situations means to optimize people that take care of these people. There's lack of some specialists. They are not well distributed. For example, 60% of urologists are located in the capital city, but not in other countries. The investigation is considering all the omics. So we need to organize the patients, because regarding the treatments, this is non-existence. In Argentina, for example, the patients are not, the situation is not well organized to take care of bladder patients. I'm very proud to say that in the northern part of the country, we are distributing all the people that suffer from bladder cancer. And as far as I know, this will be the first cohort for a study of patients with bladder cancer, which is really a great finding or a great deal. Now, there's disparity. As I said, patients don't do well. So we do have a great opportunity with these patients. Thank you very much.
Mm-hmm. Now the questions now or after that? Okay. Mm.
Yes. So does anyone have any questions? Yeah. So Why do you think that we have not yet seen so much patient advocacy in Latin America? And what do you think we need to do? What can we do as a community to encourage that?
Well, I don't have the answer really. This is not a problem of bladder cancer. It's a problem with all diseases. There's no culture of organization of patients. In children, in pediatrics, we are much better organized. But for some reason in our country, this is a non-existent culture. I've thought a lot of things. Probably this is a matter of taking care of things inside and not outside.
Clearly, it is something that is still missing, and from the point of view of the authorities and the organizations, well, there is no benefit from this being generated. Definitely, well, there has been an act approved in Chile, and it includes that all of the different organizations are addressing the patients in a certain way. So there is where, with Fiorella, we can talk how to improve this. But this experience about the patients, it's not something that is published. It's something that we speak with the patients and we ask them, how is your daily basis on the hospital? No one really cares about them. So I think this is a real issue.
There's a question.
Do we have any questions? Can you introduce yourself, please?
I'm Eduardo Hernández. I'm with Maria Castillo with the Fundación Amigo Como Tú. It's an organization that works with patients with leukemia cancer in Dominican Republic, and I would like to thank you for the opportunity of being here in this great forum. And I'm really thankful. Welcome to this country, even though that is small. Thank you, Doctor, for your presentation. It was amazing. What I would like to ask, as you're saying, we are also lacking in information. We have several organizations of patients, not that much in bladder cancer. We have some patients, but they're isolated. But what I wanted to know, aside from the tobacco, what other incidents is what can provoke a bladder cancer, and how we can make the population aware that it hasn't arrived right to us, so that we won't get there. Well, it is very important. And another important point is the lack of awareness in the broad population. There was a case recently, and well, the patients don't really care about the people close to them that have bladder cancer, right? Because they have to go to the private sector. So, well, tabacism is 70%, right, of all of the cancers, lung cancer and different types of cancers. There's other specific factors like working exposures associated to different situations, like different fabrics, right? But definitely, well, it is a factor that is decreasing on a certain weight. There's arsenic that I already told you about, and well, what is more described in Taiwan, Bangladesh, Argentina, and Chile. And we have certain patients that have been in certain therapies, like in lung cancer, in cervical cancer, and other types of cancers, and they have been treated with chemotherapy. And well, a thing that is very special in the north of Africa and Africa in general, there's a cancer, another type of cancer, secondary to a parasite disease. We do not have it in Latin America, fortunately, but definitely there is another thing that is considered with this squamous cancer. And the awareness, it's something that we have to consider very importantly in Latin America.